I'll now call the meeting to order. To those that are here, thank you for showing up, and those that are watching at home, thank you for watching.
Good evening. Notice of the public meeting of the City Commission of the City of Brownsville pursuant to Chapter 551, Title 5 of the Texas Government Code, the Texas Open Meetings Act. Notice is hereby given that the City Commission of the City of Brownsville, Texas, in accordance with Article 5, Section 12 of the Charter of said city, will convene a regular meeting on Tuesday, December the 10th, 2019 at 5 p.m. in the Commission Chambers on the second floor of Brownsville City Hall, Old Federal Building located at 1001 East Elizabeth Street, Brownsville, Cameron County, Texas. Please stand for the invocation and the Pledge of Allegiance.
Let's pray. Father God, we thank you for our many blessings. And during this time where we celebrate the birth of our dear Savior, Jesus Christ, we accept your example. And Lord, help each of us to use that example to be giving to each other. Not only our material goods, but help us to give love and understanding, encouragement to everybody, those that are close to us and those that are not. Tonight, we especially ask for wisdom for our mayor and city commissioners and every presenter for the best for the city of Brownsville. And we ask all of these things in the name of Jesus Christ. Amen. And now, tonight, we're also going to have a moment of silence where each of us can add our prayers to the ones already said, including those of other faiths. Amen.
Thank you. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. At this time, we have a proclamation to Mr. John Kinch. If you would please come forward.
Commissioner Gowan's not here, so I'm going to go ahead and read it.
Oh.
Good evening. How you doing? A proclamation of the City Commission of Brownsville, Texas, recognizing and honoring John Kinch. Whereas the Board of Adjustment is a quasi-judicial authority for the City of Brownsville, authorized by the Texas Legislature under Local Government Code and by the City of Brownsville under City Ordinance to render decisions on appeals which allege error in an administrative order, requirement, decision, or determination. Herein decides special exceptions to the terms of a zoning ordinance when required by ordinance, and authorize in specific cases a variance from the terms of a zoning ordinance. And whereas the Planning and Zoning Commission exercises powers authorized by the Texas Legislature under Local Government Code and by the City of Brownsville under City Ordinance, including making recommendations to the City Commission on zoning, rezoning, district boundaries, zoning district regulations, and related zoning matters of high importance to the City of Brownsville. And whereas John Kinch has consistently served as a volunteer on either the Board of Adjustment or Planning and Zoning Commission from 1985 to 2019. And whereas John Kinch served as a leader on the Planning and Zoning Commission for years as its chairman and as a distinguished member throughout his tenure on the commission. And whereas John Kinch served as a leader on the Board of Adjustment for years as its chairman and as a distinguished member throughout his tenure on the board, where he is lauded by his fellow board members and by city staff for his dedication, wisdom, and service. Now, therefore, we, the members of the City Commission of the City of Brownsville, Texas, by virtue of the authority vested by the Charter of said city, and on behalf of all of our citizens, do hereby recognize and honor John Kinch and encourage the residents of Brownsville to celebrate his contributions to our community, done this the 10th day of December 2019. And it's a particular honor for me since John and I are neighbors. We live right across the street from each other. So thank you for your service, John.
Would you like to say anything, John?
I would comment that I was looking at the board across the back, and the number of mayors that I served under is amazing. So
Very good. And Mirna Leal, if you'll come up with us also. Mirna Leal from Planning and Zoning staff. Mayor and distinguished commissioners, I've had the pleasure of meeting John Kinch back in 2015 when I was first appointed to the Board of Adjustment. And it's been a real pleasure over the last several years to work with him, to learn from him, and to watch him as he operated, exercising his wisdom and his years of experience and putting them to use to ensure fairness and justice for the citizens of Brownsville. So when he let us know that he was not finally applying for reappointment to his position on the board, several of us got together and city staff joined us in wanting to recognize Mr. Kinch, and that's why we put forth this request, and we also have a plaque to present to Mr. Kinch tonight as well.
Mr. Kinch, on behalf of the City of Brownsville, the Planning and Zoning Department, and the Board of Adjustments, we present you this small token of our appreciation. It's an amazing dedication that you've shown over better than 30 years and such wise instructions you've given to us that are currently serving. Thank you for your service, sir.
Thank you. I appreciate it.
Thank you.
Thank you.
Thanks. Roy Dillon, thank you.
Next, we have presentations. The Challenge RGV.
Good evening, Honorable Mayor, Commissioners. This evening, I would like to invite all of our city staff and our citizens of Brownsville and our city commissioners to talk about something that's really important for our citizens, and that's about a 12-week program that we're now looking at our 11th year, and that's called the Challenge RGV. A little bit of background: the Challenge RGV originally began as the Biggest Loser 10 years ago. It has transitioned to become a Rio Grande Valley-wide program now, and the number of people who subscribe to this weight loss program has grown in the thousands, usually beginning in January and lasting through April. This is probably the first wellness kickoff event that we had in the city, not only to work with our city staff, but to have a citywide impact. And over that time, we've seen not only Brownsville lead the way, but we've seen other communities in the Rio Grande Valley subscribe to these type of wellness activities. Now, tonight, as you see up here, we want to invite everyone specifically to the Friday, January 10th event occurring at the public library, both locations. And then on Saturday, the official kickoff on January 11th from 9 to 12 at Linear Park. These events are put on for the public at no cost to the citizens. They're all free event, and they are meant to encourage a natural, holistic weight loss approach. That's really important because it allows people to find ways to either increase consumption of healthy foods or increase steps, whichever method they can subscribe to, whether going to a gym or merely going to a park and walking, or even through the Park RX program that the Challenge RGV is about engaging the community in a very positive manner that has resulted in thousands of citizens coming on board. So tonight, I just wanted to offer this to our citizens to subscribe to the Challenge RGV. We also have different categories and awards. We have a large group category, small group category, individual male, and individual female. Now, because we do work with collaborative partners, private businesses, the University School of Public Health, we are able to allow people to have prizes. Some prizes can be up to the big prize up to $1,000, but anyone who loses 5% of initial body fat can also win smaller prizes. Now, the true incentive here are not the prizes themselves, but it's the behavioral changes that come about by having one event, bringing people together to what we now call the Challenge RGV. Thank you.
Thank you.
Next, we have the next presentation, UT Health Science Center at Houston School of Public Health.
Honorable Mayor, Commissioners, it's my honor to introduce today the University of Texas School of Public Health, Dr. Reiniger, whose campus has been one of the first campuses when the medical school came down, and since then, the city of Brownsville and the university have been collaborative partners in many initiatives, and I believe that this relationship continues through the present, and Dr. Reiniger will talk to us about some of the health issues and evidence-based solutions that are available through them. Dr. Reiniger?
Mayor, Commission, thank you so much for allowing me to be here and talk about the latest information we have about health in Brownsville in particular, and some solutions to continued improvement. The University of Texas School of Public Health sits on the UT RGV campus and the Texas Southmost campus right down the street, and we want to make sure that people know that we're there, and we welcome collaborations. This is just a photo of our building, and we've been there since 2001. And honestly, our main partner has been the city of Brownsville and doing work in Brownsville to make a difference here. One of the big studies that I want to tell you about, because it gives you a snapshot, a picture of the health status of people living in Brownsville, was created in 2003, and it's the facility is actually housed in Valley Baptist in their Edelstein building, their professional building. And in this facility, the Cameron County Hispanic Cohort is conducted, and this is a study where we go home, knock on doors, invite people to come into this clinical research unit and take part in a study that helps us characterize the burden of obesity, risk factors for obesity and diabetes, access to health care, etc. All of that to provide us making decisions about a scientific base for interventions and prevention. It gives us the facts that we need in order to make good decisions. And this study has been led the whole time by Dr. Joseph McCormick and Susan Fisher-Hawk. So I want to highlight just a few of the data points that I think will be of interest to you. This is based on over 4,700 people who are not only enrolled in the study, but they're followed over time, every 5 years. So some people are now starting their 20th year of follow-up. So it allows us a very unique picture. It's a sophisticated study in the sense that there's behavioral information collected, but also a lot of clinical information. It's not just unique in the Rio Grande Valley, it's actually unique in the country. And so there are many collaborators that know about this and are really excited to work in this area because of this resource. So it's a lot of additional resources. It's been used to design programming already, and we just want it to make sure that you're aware of the latest findings. So in this slide, there's a few things that I want to point out to you. One of them is the prevalence of obesity in the area. Half of our population is not living at a healthy weight. That's what that tells us. And as an implication of that, almost 27% of our population has diabetes. This is compared to under 10% nationally of people who have diabetes. So you can see that our obesity rates and the other conditions that we have are driving a higher diabetes rate. Obesity and diabetes together are things that we need to continue to pay attention to. I also just want to circle this one or more health conditions. The fact is that when we look at our citizens, our people living here, that it's not just one thing that people have. It's often multiple things. So it makes it complicated to treat it, and even that much more important to prevent it. The other piece I just want to point out here is that males and females both have high rates of obesity. It's not one or the other. Both populations have high rates, and you can kind of see that in the comparisons of males and females, and really across all ages, although the older we get, the heavier we get. So you may say, well, that's not such a great picture. and I would agree with you, but there's some good news as well. And so I want to share some additional information about diabetes and obesity and the trends that we're seeing. Because cities like Brownsville have been leading the way in making a difference, changing these data. So I'm going to talk to you about a report that's just recently come out by our partners with Unidos contra la Diabetes, and it's based on 2 data sources. One is the one I just talked to you about, the Cameron County Hispanic Cohort. The other is a telephone-based survey that's done nationally, and it's done in the Rio Grande Valley. And so we used those data to give us a picture of, are things improving at all? So I'm going to leave this report with you that has all the details of it, of this, so you can dive in as you see fit. But I wanted to point out a few things. One is that the Rio Grande Valley continues to have higher rates. In this case, we're talking about diabetes on this particular slide. We still have higher rates of diabetes. But our trends are very different than the state of Texas. So we're up here in orange, and our trends are going down, whereas the state of Texas here in yellow, those trends are starting to go up. This is good news, especially for an area like ours where we're already too high. We want to be doing that. And that doesn't happen by chance. That happens by strategy and purpose. And so that's diabetes. Obesity is much the same. Again, our rates of obesity are higher than the state of Texas, but our trend line is going down, whereas the state of Texas is getting heavier at a very rapid pace, actually. So we're moving in the right direction, but we can't stop there, right? We have to keep going. We're not where we need to be. One of the main benefits of even these slight decreases is that it saves us money. It saves us money in healthcare costs, and it saves us money in the fact that we have a more productive population. And these are just on that, at a minimum level, we saw a 10% decrease in diabetes, and that means approximately 19,000 people now fewer have diabetes. They didn't convert to diabetes, right? It's $200 million each year just with those 19,000 people fewer with diabetes. That's a minimum estimate. A higher estimate based on that top line is actually closer to 15%, so you'd add another 100 million in savings per year. So you can see that there's a substantial savings by preventing disease. In addition, obesity has different costs associated with it, and we saw a slight decrease there. About 5,500 fewer people then would be classified as obese, and that estimate results in 587,000 annually, right? If we keep them there, we keep seeing that in direct healthcare costs and lost productivity. So we're not talking small numbers, right? Small changes in these trends result in big economic impacts. More people spending money on things around their life and in our economy rather than just in healthcare. So so what are some of the strategies that have been contributing to this? We can't say that it's one thing that has created this downward trend. It's multiple things, and we're proud of that, actually. It creates synergy, it creates partnerships. So I wanted to talk to you about a few things that the School of Public Health has been contributing towards these efforts in partnership with the City of Brownsville and others. So one of the efforts is a community-wide campaign. It's an evidence-based approach to addressing physical activity and healthy food choices, those precursors to obesity and diabetes. And we started this initiative with Brownsville, and we've been working on this for now over 15 years. The challenge that you just heard about, the weight loss challenge, is one element of that. The campaign itself is built on the idea that when we combine media messages individual-focused activities, and environmental and policy changes that align to promote physical activity and healthy food choice, we see improvements. We see people getting healthier. So we collectively took that and have been implementing it under the banner of Tu Salud Si Cuenta. There's the three aspects that we really talk about: increase in physical activity, choices, substituting choices so that you're consuming more fruits and vegetables, and looking at our portions. And as we have gone through and implemented this through mass media, through the messages on social media, on mass media, in newsletters, implementing social supports elements through free exercise classes across the city, community education events, text messaging supports, risk factor screenings. One of the things that we found from our Cameron County Hispanic cohort data is that over half of the people that came into this cohort study who had diabetes, when they walked in the door, they did not know they had diabetes, right? So they were living with a condition that they needed medication for to help them manage it, but they didn't even know they had it. So risk factor screening is key. People need to know that they're at risk and what they can be doing so we can help them. So that's another element of this campaign. A lot of education around diabetes prevention, or around nutrition, and then environmental changes, creating places and structures that allow people to be healthier. This is, the way I look at it, this is the kind of the special combination that when you put it in place, you start seeing the kinds of decreases in trends that we're talking about today. These programs rely heavily on community health workers, individuals who can serve as coaches that go into homes, help connect people to resources, answer questions that are personal and focused on making a difference in their lives. And what we see when we implement this is people are, find the right pen here, they are increasing their fruit and vegetable consumption, they're increasing their physical activity, they are overall improving their blood pressure, which you see here. And so they're making the changes when they enroll in these kinds of activities that we would hope to see. And these are just some photos that you can see. People in Brownsville are out being more active and meeting some of the guidelines that will help them be healthier. So we're doing health screenings and exercise. There's also another program that I'm really glad to take just a few minutes of your time to tell you about that's also reaching thousands of people in Brownsville who have diabetes, and in particular who have uncontrolled diabetes. They're part of the patient population at some of our federally qualified health centers, Clinica, Brownsville Community Health Center in particular in our Brownsville area, and they are referring their patients to this program, the Salud y Vida program, where we are providing continuity of care services to help these individuals go from being uncontrolled to being controlled. So what does that look like? It means that anyone over a 9 on their A1C, it's a measure of diabetes control, is out of control. And so you can see that when we start, that's where people are. That's why they're referred to the program. But then they drop below to that number. And in fact, over 70% of the people enrolled in the program are showing improvements. And why that's important is that when we reduce A1C, this measure of control, when we reduce the A1C value, it shows us reduced risk for complications. And every one of us knows somebody with diabetes complications who we would like to have them avoid that. So this is another resource, another program that many people in Brownsville have access to. So as the city goes forward and thinks about building health and how do we do the best for our employees, how do we do the best for our citizens, these are the recommendations based on evidence that I wanted to make you aware of. Part of it is awareness, making sure that people not only are screened, but they are referred for help. right? Because we've got to do the screening because not everybody knows they're at risk. That social support is another core element, having people that can have that meaningful coaching experience, making sure that the referrals are there, that there's constant contact as we go through and try and make behavior changes, that there's support for that. That there are a number of educational opportunities that are available on exercise or diabetes or cooking or lifestyle changes, and then it could be family-based or individual-based. Another element is the environmental changes that you as a city are working towards making the healthy choice, the easy choice, because our environment supports that. There's a cue to action there. Media, we can leverage social media in particular to help make sure that there are stories that focus on our citizens in Brownsville showing how they're making these improvements. It encourages others to do the same. And then finally, incentives, where we're seeing behaviors that we want to incentivize that. Things, for example, days off or co-insurance, your co-pay would be reduced because you're doing the things that will make you healthier and ultimately save dollars in your insurance program. I would be glad to answer any questions, but that's an update on where we are in terms of health.
I just have a quick question. Earlier today I had a meeting, and since I was running, there's a great need for mental health classes or workshops. Is that part of a component that y'all address, or maybe even physical and mental health balancing, like the importance of sleep, meditation, and those things? Is that something that y'all ever touch
Thank you
upon?
so much for that question. I was hoping I would get a question like that, because it's a really important part, both in our Tu Salud Si Cuenta campaign generally, as people are in exercise classes or people are in the various education, we're able to have dialogue with them, understand what kind of maybe anxiety or depression that they may be feeling, and get them referred to help for that. The fact that the health coaches are there and get to really come alongside them. There's a better relationship to be able to talk about those things. And then on our Salud y Vida program as well. The behavioral health, the mental health and stress and anxiety they're essential. If we're not managing that, we're not managing other elements of our life. So we can't separate them. Great, thank you.
I have a question. Does your program focus on childhood obesity and diabetes as well, or is it just the adult population?
No, thank you. That was another great question I was hoping I would get. Another element of some of the work that we do is a program called MEND, and it's a program specifically for families and for children who are already at a young age, between 6 and 13, already overweight or not at a healthy weight. And it's specifically designed for kids and a parent to address that. And it comes alongside of the family. It's a long-term program because it's not a quick fix. We have a lot of behaviors that go into that. And we've reached well over 1,500 children, and we're showing really neat results, and parents like it because they lose weight too. So, thank you for asking that.
All good news. Thank you.
Thank you for your time, and I'll leave these.
Thanks.
Next presentation we have is the U.S. Bicycle Route System.
Mayor, Commissioners, I'll quickly go through this. The request basically is a request for support of an application of the U.S. Bike Route System. As you all know, the active plan became the Caracara Trails, and the advisory committee is made up of these 20 entities from all over the county. The goals are economic opportunities through Cameron County, diversify the local tourism market, link Cameron County communities, and create a regional bicycle pedestrian network. And to go along with Belinda's mission is promote healthy lifestyles. And so The U.S. bike route system, this is a map, it's a three-tiered map. It's the green on the right side by the island is a kayak trail or water trails. The blue is the proposed U.S. bike route system. And the red is off-road trails. And so your typical, like your battlefield trail. And so the plan calls for the development, the overall plan is 428 miles of infrastructure, 230 of the multi-use trails, 78 of paddling, and 120 miles of on-street system. The USBR is actually the easiest part of this plan in the sense that it takes the least amount of funding to just put up a sign and designate something, the US bike route system. And so these are some of the tourism elements and what it does in other communities. That's from a trail perspective. The great example is being the Great Allegheny Passage between Pennsylvania and Maryland, creating up to $100 million in annual spending. These are examples of water trails in other states. And when we did the active plan, we really wanted to see what the economic benefits would be here in Cameron County. And so if you take the seven projects that were considered the projects that you could implement the quickest, you would have a total of $70 million in annual spending. And you can just see the breakdown of how that would work over time. These are some examples of what those trails would look like along Resaca, along the Arroyo, potentially. And this is what I said, the red is the multi-use trails, much like your battlefield trails. So you start to see a full system. You can go from Brownsville to Laguna Vista, from Brownsville to Harlingen, vice versa. And so part of that plan was also engagement, and so this is what it would look like in the rural areas, outside of the city. As far as what we're doing in Brownsville, this is the Southmost Nature Trail. Phase 1 is already built. Phase 2, the following phases are funded through Category 7 funding, TxDOT, but they're in design. And so the funds don't really come until 2022, so we still have a little bit of time there. And so, but we're already working on it. This is the Battlefield Trail, the trail that everybody knows. Los Fresnos Trail. So part of this trail, the one that's closer to the Battlefield Trail, or the battlefield, is already built, and then the other part, this is in segments. The other part is funded by the Legacy Foundation. That is currently out for bid. The bids are due December 18th, and that's a 2-mile extension. And then the rest of it going to Los Fresnos is also funded, but later years. So it's funded, I think, in 2024 or 2025. The funding's already there, but it just takes a while to get there.
Funded by the MPO?
By the MPO, the Brownsville MPO. At the time, it's an RGV MPO plan. The BAHIA Trail, this is perhaps the signature project of the active plan. This is varies on the alignment, but 18 to 20 mile trail connecting Palo Alto or Brownsville to Laguna Vista, Palo Alto to the Bahia Grande National Wildlife Refuge. So you can start to kind of think of what kind of attraction this would be to tourism. And this is a picture out at Bahia, and that would look like a rest stop and some other stuff. And so the Bahia Trail would end at the South Texas Ecotourism Center. So the county the county and Laguna Vista partnered up on the South Texas Ecotourism Center, and that's the rendering of what they are proposing. And I believe they are already out for bid on that too. And so that's funded and underway. These are some birding pictures. So that takes us to the U.S. bike route system. U.S. bike route system is an official designation. And the TxDOT must apply for it. Well, in this case, state TxDOT. And they're cataloged and designated by AASHTO. So that's the kind of the premier organization that regulates departments of transportation. They're designated with numbers and they're mapped and signed. So that's kind of what a typical bike route system would look like. It's on road. It has a little bit of a buffer, and then you have your bike arrow. This is a picture of the nationwide plan, and so I don't know if you can tell, but The solid lines are lines that have already been officially designated. And so the other ones are proposed. And so, you know, actually this is a new map because they used to have it ending in McAllen. And so now they shifted it over to Brownsville because of our work, which is good. As you can see, there's no plan, there's no designated bike lane or bike route system in Texas. And that's really because no other region or city has really thought about it. And so if this process is successful, Brownsville and Cameron County would be the first designated part of the bike route system in Texas. And so there's the kind of the way that it would flow through Texas, north, south, east, west. And that's the map once again, the blue trails connecting Combs. Actually, I learned something today. U.S. bike route from Combs to the island would be 255, and from Combs to Brownsville through Los Indios and Harlingen would be 55. So there's two numbers there. And so these are the segments. There you see the blue lane, the blue time, and that's what covers, it's Brownsville, how it meets and ends in Brownsville at some point. What does designation mean? Is a route that is officially recognized. It's obviously studied and approved by AASHTO. There's no inherent liability for any agencies per the Federal Transportation Board. The signage is nice but not required, so ideally maybe in a good section of it we'll put the sign just underneath the speed limit sign or something like that. Does not impose any constraints or restrictions on the use of the road. So like we said, it doesn't change anything. It's just a designation. And so that's the application. TxDOT has chosen the active plan, Cara Trails, to be the first one in Texas. And so I think we're extremely proud of that. I think that also says a lot for the work that's been put into this plan. And so, you know, it'll bring, the vision is it'll bring bicycle tourism, it'll be a destination, and it just puts us on the map. And so, December 2019, I know Rails to Trails couldn't be here because they're also presenting in Port Isabel and Laguna Vista tonight. So Eva asked me to present here. And so
I think you covered everything.
Yeah.
No more so.
I think I've done this presentation once or twice before. So anyways, we submit the draft, TxDOT reviews the application, sends it off to AASHTO, and then by June we could potentially have the designation. And so those are the partners, and that's it.
So Cara is the whole active trail now?
Yeah, it was rebranded. We couldn't keep calling it the active plan and sell that, so.
Is the Palo Alto is part of that? Palo Alto
Battlefield?
bike
Yes.
deal? And the southmost one's going to be part of it?
Yes.
Is the West Rail Trail included in that?
This plan, it does include the West Rail Trail.
And is the funding going to come from the MPO for all this?
For
the Cara Trail?
I mean,
Countywide,
there's
right?
multiple funding. So, for example, the trail going northward from the end of the current battlefield.
The Legacy.
Legacy founded it. So there's a mix of funding. There's federal that's non-NPO. I mean, there's
Only?
Yeah.
But they're involved. You said Title VII was being used for part of it, right?
Category 7 is the Southmost Trail was funded through Category 7 about 4 years ago. But like I said, the money doesn't come free until 2022.
What do you anticipate cost to be to the city of Brownsville?
For the US,
For any part of
for
it?
USBR, nothing.
Okay, but for the whole thing, Cara Trail?
So
mean,
every city, it's multi-jurisdictional, right? And so really, we're not going to pay for something that's in Harlingen, right?
So
And so
our part of it, what do you anticipate?
I don't have that number specifically.
No idea?
I can get you the number. I just don't have it right now, but I'll surely
would
get
like
it for
to
you.
know it.
Sure, absolutely. So the request is just we'll put a draft together, a letter of support that we could submit to TxDOT specifically for the U.S. bike route system.
Which doesn't cost anything other than some signs if we, at our option.
Yeah.
Yeah.
So, thank you.
Thanks.
Next, we have the public comment period. We did have someone sign up, Mr. Ernesto Hernandez. If you please come up. He's not here, so we'll move on to the next one.
Johnny walks in.
Next, we have our work sessions. Letter A, charter election timeline.
Good evening, Mayor, Commissioners. I'm Elizabeth Walker in the Office of the City Manager. Since the commission has reactivated the Charter Review Committee, making some appointments last week and potentially more appointments this evening, we wanted to provide some information that would provide a context for the scope and scale of the significant undertaking they have at hand. So some of the information we wanted to bring to your attention, these on the leftmost column are the uniform election dates. We provided May 4th, the most recent local election in the city of Brownsville, for a basis of comparison. So if you'll see the upcoming election dates, May 2nd, 2020, November 3rd, 2020, May 1st, 2021. The election order would then be issued, as you can see, several months prior. And these are the election costs. That's the actual election cost for May 4th, 2019. The rest are estimates as provided by the Cameron County Elections Office. So there's some information as far as setting the timetable for when it is that the Charter Review Committee would be presenting its work to the community. The other elements we just wanted to bring to your attention are the salient documents which would give them their authority. One of them is the local government code, and we have that identified here. Any amendment may not contain more than one subject. The reason we call your attention to this is just because the wordsmithing will be very important. How it is that they identify the propositions on the ballot. That will be the critical work of this Charter Review Committee. And the other salient point is that the Texas Constitution provides that no city charter shall be altered, amended, or repealed oftener, that is Texas Constitution language, oftener than every 2 years. So the idea is that the wordsmithing be so critically important because they cannot do this again for at least another 2 years. Do you have any questions for me about the work of the Charter Review Committee?
I do. One really quickly, on the November 3rd, 2020, why is it that that cannot be absorbed into the actual election that's going to occur in November?
Each entity participates in the election cost. So a separate paper ballot would be prepared on behalf of the city of Brownsville as its own entity participating in that uniform election date. So we would cost share in the polling locations and the polling workers at each location.
But this would bring an additional cost of $255,000 just for the charter election?
Yes, sir, because that is a general election date, so presumably it's a bigger ballot. It's a bigger election.
Okay.
It's unfortunate, but
Now, when it would be absorbed into the cost is when the city of Brownsville has its own scheduled election, a local election, and that would be May 1st, 2021.
and so that would cost the city $0.00 because we're already paying for the election to take place May 2021.
Yes, ma'am.
Okay.
That's what we'd expect, because there would be an at-large election on that date for the city of Brownsville. So we're already incurring a cost for all
every
districts,
single-
all precincts participating on that date. And it would be all precincts participating in a special election to consider charter amendments. So that's the day they're all already participating. And that would be budgeted.
Okay. Anybody else? Thank you.
Of course.
Ne-
Go ahead.
Next, we have work session B, wellness program update.
Mayor, we would like to see if we can just switch the order on these. I know Dr. Godwin's on her way. She wanted to take part in that wellness program discussion.
Okay. Well, so then let's just go ahead and take C first, which is County Southmost Office update.
Next, we have work session C, County Southmost Office update.
Yes, Mayor, this item was requested, I know Commissioner Galowski has an interest, this is inter-district, and the county has plans for a substation. We have Mr. Isaguirre here. We also have members of our engineering staff who can provide an update in terms of what we have done internally to work with the county on the conveyance of this particular property.
Good evening, Mayor and Commissioners.
Good morning.
Good evening.
Good evening, actually.
Now I know why Pete asked me to be here. He didn't have a presentation like everybody else. But anyway, he called me about 2 o'clock this afternoon. You gotta go to the City Commission. But anyway, this project started as an idea back in December of last year, where I visited my office there at the Brownsville PD station there on Southmost. Every so often I go visit, a surprise visit to my offices countywide. We have 9 offices countywide. And of course, as usual, there's those long line, people complaining, and you know, I said to myself, something needs to be done. You know, of course, that's not our building. We were there rent-free since 1999. But it's been very, very helpful for the citizens of that area. As driving back, I took the long way and I went down Southmost and I saw a huge vacant piece of property there. And I said, why is it vacant? What was here? And I said, then I remember, oh, there used to be a water tower here. So when I got back to the office, I sent a letter to the county judge and commissioners, and an idea was born as to the possibility of the county building a county annex building, tax office there at that corner. So we started with a simple memo to the judge, and of course, since there was a water tower there, we sent a letter to back when to the PUB board, trying to get information. Of course, we thought since there was a water tower there, we thought that the property was owned by PUB. But in doing a research, and we contacted Rio Grande Valley Abstract Company to do the title search on that particular property. And we found out that the property is owned by 2 entities, the City of Brownsville and Brownsville Independent School District. It doesn't belong to PUB, even though there was a water tower there. The property was deeded to the Brownsville ISD in 1953 by the Faxon family. And then part of it was deeded to the City of Brownsville in 1960 for a water tower. Apparently the PUB did not exist back then. That's why it was deeded to the City of Brownsville. So the deeds are the properties are owned by City of Brownsville and the ISD. Our plan is to hopefully work together, because that property can only be used for public use. And having a county building there, servicing the same individuals that we service, since we are, my office is I am the tax assessor collector for BISD and for the City of Brownsville for many years now, since 1988.
Wow, congratulations.
Ma'am?
Congratulations.
Thank you. So I believe that having a building there big enough with space to grow could be very, very beneficial to the citizens of the southmost area. There's approximately about 40,000 individuals out there in that area. So what I did, well, I took the liberty of contacting one of the architects, Stan Knowles, and he put together, at no charge, he put together a plan, a drawing, and we came up with a 4,200 square foot building that's going to house 3 to 4 employees. It's going to have 2 drive-up windows. And the idea in having that building is to service our taxpayers, same taxpayers, and offer additional services that we now have. In our office in the southmost building at the Brownsville PD, the only thing we do is collect property taxes for all the agencies and do title transfers. Our plan is to enhance and offer additional services, the same services that we offer, plus copy of deeds, marriage licenses, anything having to do with the county clerk's office, anything having to do with the district clerk's office. So this would be a fully functional building, full service to the citizens of that area. So, but the issue now is getting the property transferred over to the county from the city of Brownsville, their portion, and then making contact with BASD to do the same. And the building is estimated to cost $1.2 to $1.5 million building. And it'll be able to service the needs of the community. Any questions?
I'd like to add that since it is in my district, I think the need is there. Right now, they only have one person working to collect these payments, right? And so they're
Yes.
limited to the hours of the building.
Yes.
And plus, she needs to take her lunch hour. So the ability to have a bigger space where you can bring in more people to service the customers will allow for a quicker turnaround of better customer service, too.
Exactly, exactly. And seeing that it's the same, and I forgot to mention that maybe possibility of servicing since we're talking about the same individuals, same taxpayers, offer the service to the Public Utility Board to see if we could service those individuals to go to that office and pay their monthly bill there. Yes, right now, our office right now it's a one-person office. We have to close at noon. The individual has to take a break, and because we're there at the mercy of the police station, we have to close at 4 o'clock. So really, that office, the existing office, is open only 6 hours a day, and that's not right. And also, part of the plan calls for our taxpayers to be seated. My plan is to have a ticket system where individuals get a ticket and are sitting down, everybody's sitting down, and they're going to be called as they come in, first come, first served. I think individuals, the type of service that we offer, having people standing in line for service is a thing of the past. If anybody has been to our office, at our levy building, we have a very, very sophisticated ticketing system where individuals are called, and sometimes we get a full house. We average between 700 to 800 individuals a day in our levy building. But I think it's going to be a plus for everybody.
I agree. Plus, this would also offer the option of drive-through, which they don't have right now.
Yes, exactly. Yes.
So I hope my peers will consider it, and
So is this something we can put on the agenda for January? Is that too quick?
Good evening, Mayor and Commissioners. Eduardo Santillan, Engineering Department. Presently, we are coordinated with Cameron County and Public Utilities Board, gathering all the necessary paperwork. Our intention is to put together a packet for our legal department and city management for a review and possibly put it in the agenda soon.
Soon, like when?
I can get together with the entities in the next few days so I can give management an exact date. It's based on,
But we're talking like January or February.
hopefully next month, yes.
The idea, Commissioner, is to make sure that the title company dots their i's, crosses the t's before we do anything. And of course, after tonight, we'll see how soon we can put an item on the agenda for BASD, because it doesn't make sense for one entity to say yes and another entity say no, because we need both parcels in order for this project to work.
But it might encourage BASD if we are already ready to go, which
Yes,
it
sir.
seems to be a real need.
Yes, sir. So my next visit would be, I met Mr. Eddy this afternoon, and I'm going to meet with him hopefully this week and give him copies of everything the title company has given us. I'll make contact with our title company and make sure that everything is on the up and up, and probably prepare the deeds and hand them over to your staff and for review. At that time, then, I guess.
You've already got a preliminary report though at this point, right?
Oh, yes, we have a title commitment from Valley Abstract already.
On both parcels?
Sir?
On both parcels, BASD?
On both parcels, yes, yes. The title commitment has been done already. I have a copy of it. I'll share whatever I have with Mr. Eddy here this week. That way your staff and your legal department can look at it, and we'll move forward on this.
Yeah, I'm sure PD would like to have a time frame to be able to prepare too.
Of course,
Yeah.
of course, yes, sir, yes, sir. Any other questions?
Thank you for presenting.
Well, thank you for your support on this project. You know, I've been working on this project for about a year. Next month would be a whole year. And I think the citizens of that area are going to be happy with this project.
I agree.
Thank you.
Thank you.
Thank you.
Happy holidays.
Now we will go back to work session B, wellness program update.
Good evening again. I'm back. Elizabeth Walker in the Office of the City Manager, and I'm joined by my colleagues who have together helped to form the Wellness Committee, an internal working group. And we'll also have join us momentarily some of our partners from external agencies who are supporting some of our work here. We are here tonight to announce our efforts to develop and deliver a City of Brownsville wellness program. And why are we doing this? Because we are determined to be proactive and innovative to stabilize the costs and to sustain the medical benefits by leveraging flexibility of our self-funded plan. Most simply, we're here because we believe our employees deserve it. Our situation mirrors a national trend by which healthcare costs have increased as much as 10% year over year for the last several years. And what we have done about it to date is we have made adjustments to the employees' contributions towards their deductible and their out-of-pocket costs. And we have asserted the same through our collective bargaining agreement negotiations with the police union, which will be presented for consideration later on in the same meeting. On the left-hand graph, you will find then the estimated impact of those changes alone already to reduce the deficit of our health plan. The other things we have done already is we have started to evaluate the data on our most frequent and most expensive diagnostic codes within the plan, and we have engaged our partners, one of whom you've already met, Dr. Reiniger, and others that you'll meet shortly, who have helped us assemble kind of a myriad of experience on service deliverables and specialized diagnoses to develop those innovative ways to improve our wellness program. Here you'll see a timeline, but a whole lot happened on October 1st. Up until October 1st, we really only made medical plan and rate changes to the plan. But starting October 1st, we relied on SA benefits to conduct an analysis of our self-funded versus fully insured options. We increased the deductibles. We implemented Teladoc to the plan as well as the Dental Network of America. We established our wellness program committee. And then that committee in turn engaged with potential partners in various meetings. These are some of our partners. TML, of course, is already our medical plan administrator. And something new and different they bring to this initiative is they have a wellness app with customization options. We'll learn more about that. SA Benefits, they're helping us to run the data analytics on our plan presently and the impacts of those changes on that plan. UTRGV, actually this one, Commissioner Galansky, you asked earlier, Dr. Reiniger, about mental health considerations. And we've met with them already to develop targeted intentional programming towards mental health, more specifically PTSD, because of our substantial veterans population, as well as the occupational risk associated with some of the professions within the city of Brownsville. And so that partnership is intentional and exclusive to behavioral health. And then UT Health, the University of Texas Health Science Center at Houston, much of what it is that you heard Dr. Reiniger present earlier, we're going to plagiarize some of their best practices and tailor that specifically to our employee population. Through our partners, we seek to provide access to intentional wellness by maximizing our self-funded plan, by expanding access to resources such as an online app and in-person coaching, and to care for our employees' whole health. We will do this through a change management rubric following the ADKAR model. And consistent with ADKAR, what we will do next is to start to build awareness and desire with internal educational initiatives and marketing campaigns. We expect a soft launch of the wellness program this spring and full implementation by this fall. It's my pleasure and privilege then to introduce some of our partners who are collaborating with us on this wellness initiative. We'll have first, you've already met, as I mentioned, Dr. Reiniger with the UT School of Public Health, but also tonight you'll hear from SA Benefits and then TML Health.
I guess I'm first. Thank you very much. We'll need glasses to work this. Yes, absolutely. Good evening, Mr. Mayor, Commissioners. My name is Mike Getz. I'm the Senior Consultant with SA Benefit Services. We currently provide the stop-loss insurance coverage for your self-funded medical plan, and in addition to this, are going to be providing the bulk of the analytics associated with how we will focus and target the wellness programs to achieve a return on our investment here. What we were asked to do initially, though, was just evaluate the status of the self-funded plan that you have today versus fully insured options. And essentially we used an analytics tool made available to us through a company called Claros Analytics, and it's a tool that's used by the stop-loss insurers and their underwriters to evaluate the risk and also to do comparisons of fully or self-funded plans versus fully insured options. I could go through all the guts of this, but ultimately what we did is we took 5 years of your historical claims data and fed that into their system, and it generated the results that we received here. Okay, one thing I thought we should probably touch on very quickly here is just make sure everybody understands the difference between self-funded and fully insured. And at its most basic level, the difference between being self-funded and fully insured is we use the city's money to pay your claims. We don't have a big behemoth insurance company out there whose money we use to pay those claims. Your participants don't pay premiums, they pay contributions. And that's insurance terminology, the difference between insurance terminology and self-funded terminology. But essentially, the way I've most effectively been able to break it down to people who don't do what we do every day in the insurance world is your self-funded benefit plan really is a bucket of money and a book. And that book is the plan document that tells us when we can dip into your bucket of money and pay doctors and hospitals and pharmacies. Now, the way we get money into the bucket, obviously, is through the contributions that the city makes toward the cost of coverage, and also the city's employees and their contributions toward that cost of coverage as well. And ultimately, that plan document, that book, is what really tells us when we can and can't dip into that bucket of money. And that bucket of money not only funds the actual claims themselves, but it also funds those administrative fees, the cost for processing those claims, and then the stop-loss coverage that covers us for those large claims. Here's the 5-year claims history that we were looking at, and essentially what we did here is we took, and I want to see if I can make this work, we went back to 2013, 2014, where we had about $10.5 million in claims. 14-15 was our basement. That's where we reached our low point, which was 9.734, and this line, if we followed it up to the current status of our plan, which is projected to annualize out at about 13.2 million, shows that the previous 3 years before this year all bumped up significantly above that line. So our trend is not even consistent. It's up, and then a little bit down, and then continues back up. It's a trend that's not sustainable. And when we look historically at the plan that you guys have had over the years and how that plan compares with the rest of the municipalities and also the school districts in the area, you guys have, hands down, the richest benefit plan for your employees, without question. Okay? So that kind of a trend is to be expected because we are offering rich benefits, but if we're going to offer those benefits, the one way we can make that sustainable is everything you all have been talking about so far today, and that's getting people healthier. We're not doing things that we should do with controlling the cost of health care at a national level. So really the only thing we have, the only lever we really have to pull here is to educate our end users of our plan and help them understand that, first of all, it's their money we're spending, because their money goes into that bucket. And the only way they can at least manage or control that trend of their increases in premium, or pardon me, contributions, and their increases in liability, which is increases in deductibles and co-pays, is for them to essentially get healthier. And that's really the lever we've got. So when we look to the fully insured, we look at it over a 1, 3, and 5-year period into the future, how the plan is performing based on your enrollment and your history. And the algorithms told us that with your plan with no changes, if we made absolutely no changes to your plan, next year we'd have a 99.3% chance of beating fully insured. And by beating fully insured, we're talking about beating it by about $2.5 million. Okay? Over 3 years, 100% certain we're going to be fully insured. And over 5 years, that 100% trend continues. So you guys are in the appropriate funding model. It's about managing within that model the things that you can't control. I think I probably have the shortest part. So what we will do, or what we will continue to do as a member of this team, is to address any data information needs that we have. We'll crunch the numbers. This same tool actually allows us to go in and make changes to your plan benefits, and it will tell us financially what the impact of those changes are. And so if we're looking at accessibility and we're trying to get people in to see a nutritionist, and we decide we need to change the copay on the plan to 0 for nutritionists so people can afford to go to the nutritionist, we can model those kinds of things. Okay? So that's the value we anticipate that we'll be able to add to the program. Does anybody have any questions for me? All right. Thank you all very much for your time.
Thank you.
Thank you for presenting.
Thanks.
Mayor, Commission, as we welcome TML to the lectern, We did email the full presentation yesterday
Yeah.
in case there are any questions. There's about 30-some pages worth of data. So if you want to review that, they are available for questions. We just gave you all a cold down,
You're talking
high-level
about the
version.
SA one, right?
SA,
Yeah, I
that was
reviewed
sent
it,
yesterday.
actually.
Yes,
Yeah.
okay.
And I did have one question.
Yes, sir.
So you're then saying we are in the right plan, the way we're doing it, self-funding it, we are saving, based on what I read, like a couple $1 million a year, is that right? More or
That
less?
is
Okay.
correct, yeah. And the other model that showed a different scenario
Right.
was based on, at the time when we originally ran the model, we were in the stop-loss bid period, and we were looking about making a change to the stop-loss policy that would reduce the risk to the city, but they couldn't make that financially attractive enough to us, so we just kept everything as it was.
Okay, thanks.
Good evening. Thank you for having us here. I've been asked to talk about two things. One, the question came up, why does the city not have to go out for bids on their health plan each year? The reason for that is the value of our interlocal agreement between TML and the city of Brownsville. There is no requirement to send plans out to bid each year. Any group in an interlocal agreement with TML Health satisfies the Texas competitive bidding requirement for any plans and associated services the pool offers. And I would point you to Texas Local Government Chapter 172 and Chapter 791. So if you have any additional questions or concerns, you might want to check with your city attorney for any legal advice. On the right side of the page, I've detailed out how TML Health goes about selecting vendors to be offered through the pool. And so we would prepare a request for proposal and then detail out the steps. A good wellness program, I want to talk about the wellness program. There's a lot of wellness programs out in the community in our industry. And one thing that we noticed is there was a lot of work on the part of the city or the employer. Their benefits team, their HR team had to put in a lot of time and effort to those programs. So we decided we wanted to make our program very turnkey. And so a good wellness program needs to have some of the following items. Promote preventive health screenings, support weight management, provide flu vaccines and other preventive care campaigns, encourage physical activity, help individuals in good health and those with chronic diseases, easily track the progress to see positive results, and also offer an incentive for taking those positive actions. TML Well provides an evidence-based, cost-effective program through its tools. It assists all members regardless of their health status and supports on-site and off-site flu vaccination campaigns. Through the TML Well program, we partner with Catapult Health. They offer an on-site preventive care visit. And it's really more than just a biometric event. It's really like being in your doctor's office for a preventive care visit. We also have Naturally Slim within the program, and it's a cutting-edge weight management program. It's a 10-week online course, and it teaches people how to lose weight and improve their health without having to give up all of their favorite foods. We do all of this through the Navigate Wellbeing Solutions. It's an online portal. It's available in both English and Spanish, and it drives the group activities and campaigns and tracks the results. You can also sync up apps and devices to this portal. Oops. So more about Naturally Slim. It is a weight management program, and studies show that 3 to 5% weight loss can reduce the risk of metabolic syndrome by 41%. We had a pilot group of 400 individuals that resulted in 1,300 pounds of weight loss in 10 weeks. And it's available to all adult members on the TML Health Medical Plan, beginning 1/1/2020. It does require a minimum BMI risk factor to participate in this Naturally Slim program, and it also qualifies as nutritional counseling under the Affordable Care Act guideline
and can be paid through claim spend. So that means that it's a preventive service, and so it's no cost to the member. So then the last component is incentives, because they do motivate. I think we heard from other people tonight about that. For the pool, they offer a $150 incentive. And there's 3 ways to earn those incentives. It's a combination of doing the well-being survey and either a biometric screening and or an individual or group challenge. And those incentives can be received in the form of cash, or we have an online shopping mall where they would receive credits. So that's the end of my presentation. Do I have any questions? Thank you very much.
Thank you.
Thank you for coming. So,
Sure.
Was a personal commitment that I could not reschedule. I want to say that Art Rodriguez and I have worked for 10 years lobbying for the creation of a wellness program, and I compliment this administration because you are finally listening to what we have been trying to say for 10 years. I think in some ways everything happens for a reason, and perhaps the reason that it took this long is that we now have the data that you heard from Dr. Reiniger, that the programming and the education and all of the policy and things that we have done for 10 years are statistically proven to be working in our community, not in Dayton, Ohio or Chicago, Illinois, but we can prove that those things work here amongst our community in our people. So maybe it's apropos that we're going to kick off this wellness program at this time, where people can with confidence know that we're making great choices. So thank you for the partners that are going to come to the table. Thank you to HR, thank you to the administration. And I think that the coming wellness program will benefit every city employee and their families, and I look very forward to it.
Thank you.
To add to that, and this is kind of a little bit off, but health insurance is so important to our city staff members, and our resources are so thin. So I'm so excited, and so I, like Dr. Gowan, have sat here for almost 10 years and have seen the way that our city staff puts in so much to our city and the toll that it can take on you all and your bodies and your health, but more than that, your children. So I'm so excited to implement this and help keep our costs down and help us be able to offer you just a little bit more that we can. I wish we could give you everything, but I'm just so glad to see this in this step. And for the public that, you know, really are watching this but don't understand or have anything to do with a city staff policy, I want to remind people that the market is open right now, and it closes on December 15th if you don't have insurance. I was very severely affected with my daughter having a heart condition and not having the proper type of insurance. And so anytime, well, just not having a policy that would really protect her for needing open heart surgery or something like that. And so this is something that I think of every time something insurance comes across our desk now. We never know what can affect us. We never know what our family can be. It hits you like that. And cost of health insurance. Health costs right now are so astronomical. It literally can wipe you out. So I'm so grateful to be implementing this, and I applaud Dr. Gowan, who has advocated this for so long, and I'm just very glad to be bringing this to city staff because you all deserve it.
You know, I have one more shout out, and that's to the medical school. So when I reached out to the medical school to see whether they could help us fill the gap in mental health care that we knew we needed, the dean's office answered me within 10 minutes, and within another 5 minutes, I had an email from the chair of psychiatry. So they were very interested and are very interested in working with the city. They've begun to work with some of the other cities in the valley. I think Weslaco was one of them. And that is part of why the medical school was formed, to help improve the health of the Rio Grande Valley. So I do need to give a shout out to them as well.
Thank you. Thanks.
Yeah, just want to thank the efforts of the committee. It's a newly formed committee. They've been working hard. Mayor Commission, what you saw today was a very assertive set of actions that have been taken since the 1st of October, but also thoughtful. One of the things we wanted to make sure is that before we went too far and too deep into developing a program, that we knew we had the right model. Let's answer that question first, and SA Benefits helped us do that, so I want to thank their partnership, their value add. Also, the self-funded method versus fully insured gives us all the flexibility we need to work on any type of innovative methods to help contain costs. Also, we're approaching this with an eyes wide open approach because we know that this is a culture change that's going to have to happen within the organization, beginning with executive level support, and that's where the change management comes into play. Also, it's mirroring the community's program where we also see the economic benefits. We see the bottom line benefit to saving costs out in the community, so we hope to add more synergy and further the efforts being done by the UT School of Public Health out in the community.
Thanks.
Next, we have consent agenda items.
Are there any motions?
Mayor, can we take D individually?
D, yes, sir. Okay.
I'll move then to approve the consent agenda minus letter D.
Okay, very good.
A second.
We have a motion and a second. Any further discussion? Those in favor?
Aye.
Those opposed? Motion passes. Okay, item D.
Okay, so on item D, on the cover page, it says the funding's coming from certificate of obligation.
Really quickly, Commissioner, can we have the city secretary just read that item
sorry.
out so we know what we're talking about? Thanks.
Item letter D, consideration action to approve bid number RSF-10-1220 for the purchase, delivery, and installation of a prefabricated restroom facility and shower at the Brownsville Bike Barn in the amount of $96,405 within budget and available from 2017 Certificate of Obligation Funds, account number 803-512-9801-11.
Okay, so then that fund, 803, 512, et cetera, is funding both of 1 and 2? Or is the BCIC award part of that fund?
BCIC, it was an awarded grant, so it's funding half of the cost.
Okay.
And so the other part was from the Parks Improvement CO fund that we had, so it was 50 and 50.
So then it's two different funds, or BCIC separately? Then
Yeah, we'll submit for reimbursement to BCIC for their half of the
Okay,
cost.
and they had already allocated, I think, 100,000 for this. This is the bike barn bathroom, right?
Correct, but
Yeah.
50 from this, the budget was 50 from the city that we had and 50 from BCIC.
Yeah, I think originally we had allocated 100, so actually we're only gonna have to pay 50 now.
Correct, okay,
We
yeah,
being BCIC, I'm sorry.
I think, I'll have to go back to the letter, but, I mean, if they may have, I don't know, I haven't been to a meeting in a while, but if so, then they just gained.
Okay, so then the other questions are there gonna be showers there?
Yes, there will be one shower.
Okay, one shower, and then, but it's gonna cost money to use the shower, or does it cost money to use the whole restroom?
No, the facility is not intended to be charged for use.
Because they're charging a coin-operated shower at $3,500, more or less, and then they're having a bill changer for $4,000. So it's $7,500.
No, we're not charging the public for use of that. I think that might have just been an option that you could select.
What's included in the $96,000?
Okay, well, we can revisit that. That might have been to double check it.
That's what I was wondering,
Okay.
if we're
Yeah,
charging to
no,
use that.
there's no intent to do that.
Yeah,
and we-
I thought it was a public restroom, so.
Yes, it is.
Okay, so those were my main questions. The other one was the wall texture. It says stone 3150, but then I think there's a combination on the back of that page. It's part of it, according to like that picture there, part of it's wood and part of it's stone.
Yeah, it'll have a facade. It is all concrete, so it's just facade. So part of it will look like wood, and part of it will look like stone.
So the stone selection there on that second item is for the whole wall or just for that one portion?
It's for the whole exterior of the facade, for that bottom portion, or whichever happens to.
That was pretty much it. Yeah, those are the questions I had. So no charging and.
Correct.
So they can delete that or deduct that.
Yeah, we can
amount.
modify that.
So,
It's a-
okay. I would move to approve it minus those two items.
Second.
Subject to those modifications?
Yeah.
Okay. We have a motion and a second. Any further discussion?
Aye.
Those in favor?
Aye. Sorry.
Those opposed? Thank you. Thanks.
Thank you.
Next, we have public hearings. Public hearing number 1, public hearing and action on first reading on ordinance number 235-2019-061 to rezone from dwelling A to dwelling G for Lot 9, Block 7, Villa Maria Garden subdivision located at 432 West Washington Street.
Good evening, Mayor, Commissioners. This applicant is requesting to rezone their property from dwelling A to dwelling G. This property has 0.14 acre, and the proposed use is to reduce the setbacks to be able to build an alternative dwelling unit in the rear of the property. And this property is fronting West Washington Street. This is the aerial view of the property. As you can see, there is primarily residential uses within the area. The predominant zoning is dwelling with also general retail within the area. This is a 200-foot buffer map. There were 27 mailouts and 0 written opposition. The request is consistent with the comprehensive plan and future land use plan. P&Z supports this rezone from dwelling A to dwelling G.
Okay, very good. This is a public hearing. Do we have anybody here on this item? I'll entertain a motion to close and either approve or deny the item.
Motion to close public hearing?
Second.
We have a motion and a second. Any discussion? Those in favor of closing?
Aye.
We have a motion on the item.
Motion to approve.
Second.
We have a motion and a second to approve. Any discussion? Those in favor?
Aye.
Aye. Those opposed? Motion passes.
Next, we have public hearing number 2, public hearing and action on first reading on ordinance number 235-2019-062 to rezone from dwelling G to apartment H for lots 23 and 24, Block 1, Canyon Valley replat subdivision located at 3704 Menchaca Court.
So this property owner is looking to rezone from dwelling G to apartment H. The purpose or the proposed use is apartments. The property has 0.3108 acre, and this property is fronting Menchaca Court. This is the aerial of the property. There is other multifamily uses within the close proximity. There's also single family on the west side of Old Port Isabel. The predominant zoning is residential, and there is also light retail and apartment within the area. This is the 200-foot buffer map. There were 26 mailouts and 0 written opposition. The request is consistent with the comprehensive plan and future land use plan. P&Z does support this rezoning from dwelling G to apartment H.
All right, this is a public hearing. Is anybody here on this item? Do we have a motion to close?
Motion to close public hearing?
We have a motion and a second. Those in favor?
Aye.
Those opposed? All right. Yep. Motion on the item?
Move to approve.
We have a motion to approve
Second?
and a second. Any discussion? Those in favor?
Aye.
Those opposed? Motion passes.
Public hearing number 3, public hearing and action on first reading on ordinance number 235-2019-064-S to allow restaurant and medium retail use in dwelling A for lots 40 and 41, La Villita, unit number 4 subdivision located at 313 Manzano Street.
So the applicant is looking to obtain a specific use permit to allow a restaurant. The current zoning for this property is dwelling A. This property has 0.3 acre, and it is fronting Manzano Street. This is the aerial view of the property. Predominantly, there is residential use within the area. There is also some commercial business to the south. This is the predominant zoning within the area's dwelling. There is also general retail, medium retail, and dwelling retail within proximity. This is a 200-foot buffer map. There were 30 mailouts and 0 written opposition. This is the proposed site plan. The request is consistent with the comprehensive plan and future land use plan. P&Z supports a specific use permit to allow a restaurant in dwelling A with the condition that the property must comply with all city codes and regulations as determined through the site plan review process.
So as I understand it, this is a restaurant in the middle of the neighborhood,
Yeah,
Right.
this one's on.
right? Is that right?
Yes.
Okay. This is a public hearing. Is anybody here on this item? Do I have a motion to close public hearing?
Motion to close public hearing?
We have a motion and a second?
Second.
Second. Any discussion? Those in favor? Aye.
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 Okay. Do I have a motion on the item?
Can I just ask you, so how many parking spaces are going to be required?
That depends on the occupancy load. It would be determined as part of the site review process. Now, in order to prevent the applicant from having to come back and make changes to the site plan, our building division does review this proposed site plan prior to it coming to the P&Z meetings and to the City Commission meetings. So it would be very close to what is being depicted here. It is showing 10 parking spaces.
I'll move to approve. Second.
We have a motion and a second to approve. Any discussion? Those in favor?
Aye.
I'm going to be opposed to that one. So I think the ayes have it, so
I'll be
motion passed.
opposed too,
We have two opposed.
just because it's a neighborhood,
Right. That's,
but I'll
that's,
probably eat there.
that's my reason. The restaurant in the middle of the neighborhood, I just don't think that fits what we're trying to do. So that's my opinion on that. Okay,
The
motion
only
passes.
thing is, or just Manzano is like the street behind the southmost part public library, and if I remember correctly, there's a street, the main thoroughfare, on the corner. So it is a highly transited area.
Thanks. Motion passed. Thank you.
Public hearing number 4, public hearing and action on first reading on ordinance number 235-2019-065 to rezone from general retail H to general retail J for lots 7 and 8, block 96, Brownsville Original Town Site, located at 905 East Adams Street.
So this property has 0.275 acre. They are looking to change the area district from H to J. The purpose of this is to increase the unit intensity, and the proposed use is apartments. The property is fronting East Adams Street. This is the aerial of the property. Within the area, there is, in majority, commercial business. As you can see, general retail is the predominant zoning. This is the 200-foot buffer map. There were 24 mailouts and 0 written opposition. The request is consistent with the comprehensive plan and future land use plan. P&Z supports this rezone from general retail H to general retail J.
That's across from Annie Pugnat, the one that's kind of has that interior
Yes.
parking area, and then it's got 2 stories.
Correct. They're looking to refurbish an existing building and give it a new use.
Okay, that's a question I had because I couldn't tell by the documents, since it's in the historical district.
Yes.
Has this gone to heritage or to historic
It's-
preservation?
It's going to have to go to Heritage.
Okay.
They haven't submitted or they haven't requested permits yet. They're, not until they request permits, then will it be presented to the historic preservation officer.
But they're trying to get the rezoning first and then go.
Yes.
Okay. And you say it's going to be a rehab. Are they going to demolish any part of this?
No, it's
Okay.
all rehab.
Okay. All right, this is a public hearing. Is anybody here on this item?
Motion to close public hearing?
Second.
We have a motion and a second to close. Any discussion? Those in favor?
Aye.
Any motions on the item?
I'll move to approve it.
We have a motion to approve. Do I have a second? And a second. Any further discussion? Those in favor?
Aye.
Those opposed? Thank you.
Public hearing number 5, public hearing and action on first reading on ordinance number 235-2019-066 to rezone from dwelling A to dwelling G for lot 2, block 76, West Brownsville Addition, located at 1815 West Madison Street.
So again, this property owner is looking to change the area district from A to G. The current use district is dwelling. The property has 0.1377 acre, and the proposed use is duplex. This property is fronting West Madison Street. This is an aerial view of the property. There is single-family dwelling in every direction. There's some commercial business to the north. The predominant zoning is dwelling. There's also apartment, light industrial, professional office, and general retail within the vicinity. This is a 200-foot buffer map. There were 24 mailouts and 0 written opposition. The request is consistent with the comprehensive plan and future land use plan. P&Z supports this rezone from dwelling A to dwelling G.
Dwelling G lets it be duplexes, is that the big difference, or?
The reason why it allows a duplex is because since the property has 6,000 square feet, dwelling G will allow them to build a duplex in that amount, or that square footage. With dwelling A, they would have to have 9,000 square feet.
It's because of the setbacks, right? There's different setback on the back?
Yes.
25?
The setbacks for A are 25 in the rear, 25 in the front, 5.5 on the sides. With G, it's 25 in the front, 3.5 on the sides and the rear.
So A could also do duplex if they have the?
If they were to have the 9,000 square feet, they would, yes.
What was the original
It just seems
intent?
like we're doing a lot of duplexes over there on the west side, but nobody's here to oppose it, right?
Well, I'll call that right now, but what was the original intent for the 25-foot setback? What was the original intent to have a 25-foot setback on the back of the property?
It was just designed for bigger lots, just to have more space in the back. I wouldn't be able to tell you.
Okay, because typically I've seen 25-foot setbacks in the front. I don't know if this is the front, but from what I read here, it was the back.
So what I understand is the rear setback was usually put in place to allow for vehicle parking in the rear, and so that's typically a 19-foot long vehicle space, and so 25 just became an industry standard.
This is on the west side, so it probably would have been done quite a while ago. I'm not sure if it would, is there any other reason besides a vehicle? No?
Not that I
Okay.
can think of.
I'm just asking if it's some sort of public health issue or something. Okay. This is a public hearing. Is anybody here on this item? Do I have a motion to close?
Motion to close.
Second.
We have a motion to close in a second. Any discussion? Those in favor?
Aye.
Aye. Those opposed? Okay, do I have a motion on the item?
Motion to approve.
Second?
We have a motion and a second to approve. Any discussion? Those in favor?
Aye.
Aye. Those opposed? Motion passes. Thank you.
Thank you.
Thanks.
Next, we have items for individual consideration. Action item number 6, consideration and possible action to approve the collective bargaining agreement between the City of Brownsville and the Brownsville Police Officers Association for fiscal year 2019 through 2020 through fiscal year 2021 through 2022.
Mayor and Commissioners, Rebecca Hayward, as you know, the attorney that was hired to represent the city in the collective bargaining negotiations with the Brownsville Police Officers Association. So just to kind of quickly rehash the two major items on basically that we were kind of going over in depth were health insurance and base wages. So we accepted the union's last proposal to increase, they were going to increase in insurance premiums from $200 to $750, so they're increasing up $500 individual and up to $1,000.
You said premiums, but you mean deductible?
Deductible, I'm sorry, deductible. Excuse me. So we accepted their last proposal, and then our counter offer to them in base increases was 2% for each year of the 3-year contract. And they took that back to their membership, and it was approved substantially. And I believe the final numbers was
159 to 22.
159 for and 22 against. So it was ratified with substantial improvement by the membership. So I just kind of wanted to touch base on some of the non-fiscal highlights that we agreed to that I think we're really proud of. One of them is the promotional articles. So Article 16 and Article 17 is promotion with commanders and sergeants and lieutenants. That was something that the chief worked with the union on and got with other departments. So that way, we're not just hiring those who test well. So we're looking at other factors on top of just being able to just do a multiple choice test well. So that's a real improvement that both the union and the city are excited about, as well as Chief Salceda. Additionally, we have the Bill of Rights. So the prior article regarding discipline and Bill of Rights was vague. It was very broad. We looked at other cities that we've negotiated with and other police departments
where it's just provides for more due process for the police officers when it comes to discipline. And that really doesn't hurt anybody. It helps the city in trying to impose discipline, and it helps the officer in their due process rights.
It just clarifies things a lot better to make it easier for if discipline has to be issued, so that we follow rules and we have our day to present our reasonings or whatever comes up.
And just generally a lot of cleanup. There was some references to older statutes. In some of the disciplinary hearings, there was reference to guilty, not guilty. That's not how we do disciplinary. It's whether they are, whether they did the misconduct or not a guilty, not guilty stand. So we just did some general cleanup, a lot of back and forth with words, as kind of as lawyers do, with shalls and mays, and so we did that a lot. So we've been at this for a few months, but the union has approved the last offer that the city has authorized, and our recommendation is that you pass this, that you adopt this contract.
And so before I make the motion, I just want to thank our police officers for the work you do, and most importantly, thank you for coming to the table with the city of Brownsville. Obviously, we wanted to accept your first offer, and I stood with you on that. But with saying that, the cost of healthcare has become so critically high, like never before, and this is a national issue. It has nothing to do with the work or the service that you provide for us. And with that, we understand the wear and tear that goes into your body with the work that you do, and how it's going to affect you in 10 to 15 years. And so our retirees are very important to us, and your Bill of Rights for officers' rights were very important for myself, that you are protected and that you feel comfortable and that you understand this is a partnership with the city of Brownsville, and that you love to work here and you understand we're here with you. And with that being said, thank you to the union bargaining representatives, because you really, really fought. And our officers are better for that. We really got to the line of where the city could go. And so with that being said, I'd like to make the motion to approve.
Could I, well, if you want to get your second.
Yeah, we have a motion to approve. Do I have a second?
Second.
We have a motion and a second. Discussion?
So
Commissioner?
where did we end up with the integration of the police department into the civilian health care plan?
They are still on a plan, they're still on Plan C, so they're on a separate plan, but they went from the $200 deductible to up to $750. So the civilians went from $600 to $1,000. So they're still paying a little less than the civilians.
But are they going to be integrated into the, we're trying to get everybody on the same plan, as I remember.
That was one of our goals, and due to the increases that they made up to $750, we decided to just go ahead and lock that in for 3 years.
So then the next time that'll come up is in 3 years?
Yes.
So we've been trying to do this for a long time, so I hope you guys can start processing that.
Right. And one of the things that we do also have in this contract, in the second year, we have a reopener. So if, you know, as Elizabeth's also discussed with the wellness program, health insurance is a national concern. And so if we are at the point where in 2 years we need to revisit this because it's skyrocketing more, we can in the second year, and we won't open the entire contract.
Okay, well, for example, the wellness plan that she's been working so hard on, is that for the civilian plan, or does that include the police department?
It includes the PD as well.
Okay.
But then the $750 deductible, is that static all 3 years?
Yes.
And basically, the plan is the same. It's just that they have certain concessions that they gave to us on the pricing.
But
the health plan itself is the same.
Yeah, I think they're trying to get everybody on the same plan, integrated into the same plan, which y'all are in a separate plan.
Correct.
With separate, so that's one thing that was one of our goals, as I remember in negotiating this thing, the city's goals.
And one of the things that we also negotiated was that they will give us a seat to sit down with the city when they start looking at other plans to see how we can save money. And hopefully with, everybody's input, we can come up with something better, not only for the police department, but for the rest of the city employees, by looking at other departments and other things that other cities have done.
After 3 years, I would think that your plan should be seeing some results, and everybody should be able to get into the same plan.
That's the goal.
That's definitely the goal, and that's the discussions we had throughout this whole process. And I really do want to commend the Police Officers Association, because at the beginning of this, you were your insurance premiums were a little bit over $200, or I'm sorry, deductible. And you did realize, and we were very honest with you from the very beginning about our fiscal position and how it was going to be affecting the city and how it would be affecting the other, civilians that were not subject to collective bargaining. And I really do appreciate the fact that you were willing to concede those points and really just move your deductible up quite a bit. And I think that's definitely something to be commended. I appreciate you taking all those other factors into account. It means a lot to me as mayor, and I know it meant a lot to the city as well fiscally. And the goal certainly is to move over the next 3 years. I know that Mr. Bernal and I have had the discussions with you as well to try and lower those insurance costs. And if we can accomplish that, that's better for all involved. And I know you're going to be moving towards wellness plan as well. So everything's looking on track. We've got 3 years to get this right, or 2 years hopefully. And thank you.
Thank you all for being open to when we were talking about this. Part of this, the contract does include that we start using and we start getting educated a little more on how to better use the insurance so that the costs do go down. So we are planning to take advantage of that so that our members are more educated on, the options that we have through the plan, because I think that if we work together as we have been, we'll be able to both come out ahead.
Right.
And I've seen that the early numbers on Teledoc are pretty positive. They're encouraging as well. So thank you.
I'm hopeful for the future that, yeah. So I'll call the question.
Okay.
Wait, may I ask a question?
Sure.
Just for the civilian population, though, do they have their deductibles locked in for the next 3 years?
They do not, no.
So they could be raised next year?
They could be raised next year. And my understanding, Noel, is that it's really not the intent to raise next year, but to go down utilizing the wellness program that you guys are implementing to include Teledoc. Some of the just discussion with other cities, that has made such a huge improvement alone. So no, the civilians potentially could be increased next year, but my understanding is that is not the goal.
That's hypothetical. I don't want to see it come to fruition.
That's terrible.
Was it you?
So that might be me. So our commitment, what we did this year, we called it more of an intermediate step during the budget timeframe. We tweaked where we felt we had the least impact to our employees. Basically, the deductible and out-of-pocket costs were roughly around 25% or less. They would reach the deductible. Our employees didn't really reach that at a high percentage. So we also contribute toward contributions that our employees make. That wasn't touched. So we are still competitive. I think part of the issue is that we allowed this issue to go on for too long, leaving us with not too many options in the short term to cost contain and stop the bleeding, for lack of a better word. Now we're committed to a wholesale implementation of our wellness program, and we anticipate results. It does take a little bit of time. I think the mayor and I have gone back and forth on 2 years, 3 years. We're all hands on deck here. I think the officers understand where we are. We have been transparent about our numbers. We have been transparent about the realities of how this compounded over time and put us in this precarious spot. We couldn't do much between the months that we were budgeting, but now we have been more assertive, and our commitment is to remain competitive on our benefits overall, including health costs. And if we can cost contain, we intend to preserve our employee cost to the degree that we can. But we'll communicate to the commission, and our goal is to hold that line.
Okay, we had a motion and a second. Those in favor?
Aye.
Those opposed?
I'm going to go nay.
Okay, 1 nay. Motion passes. Thank you.
Thank you. Thank you, Commissioner.
Action item number 7, consideration action to award change order number 5 to Spa Glass Contractors, Inc. for the terminal project at Brownsville South Hydraulic International Airport in the amount of not to exceed $33,861.97.
Good evening, Honorable Mayor and Commissioners. We have a change order here with about 6 items on it. There's about 5 increases to the project. They were all pretty much unavoidable, and then we have 1 deduction wrapped into this change order. So the total is actually a little lower than the 33,000. It's 31,861. There was a typo somewhere. We're presenting this at the $31,000 level that is normally approvable by the city manager, but this exceeds the original award amount that the commissioner had approved, so that's why we brought it back.
Okay.
We didn't pass the last one?
You did.
So this is the second one? I mean,
That
another
last one would have been, that was actually funded through, I think the last one we did was a change order to approve funding the airlines build-out, and the airlines are actually going to be repaying that, so it's funded already. So we're not actually asking for funding for that, we're just asking for financing. That's what it was.
Those were kind of fronting the money.
Correct.
We're going to get it back, right? Okay.
This is actual money we would have to pay in excess of what was previously awarded.
Yeah, was it last meeting or the meeting before last when you had the spa glass change order?
There was one that
Right.
had to do with glass. Right.
Yeah, we did increase that, but that, I believe that was funded, I can't remember them all, but I believe that was funded through deductions that we had already change ordered in previous change orders. So we've actually done quite a bit of savings on the project so far. And even this one has a $78,000 deduction in the change order to help control these costs. So but like I said, this is the first actual increase and not a trade. This is not a trade. This is an actual increase to the budget amount.
Okay, do I have any motions?
Motion to approve?
Second.
We have a motion and a second. Any further discussion? Those in favor?
Aye.
Aye.
Those opposed? Motion passes. Thank you.
Thank you.
Action item number 8, consideration and action to award a term contract to JIO Construction for grease trap and septic tank cleaning services for the City of Brownsville, bid number GTC-63-1019, as stipulated pricing on as-needed basis by each city department.
Good evening, Mayor and Commissioners. My name is Roxana Moreno. I am the Internal Service Director, and I'm here today to present this agenda item for grease traps septic tank cleaning service for City Department facilities. We only had one bid submitted, which staff recommended to GIO Construction, which is a local vendor. This is a 3-year contract with the option of 2 additional 1-year term. There was no previous contract in place, so this is something that we're implementing.
Does this service, it's the city that's going to, or GIO is going to provide it for the city?
For our facilities.
And so, is this like a truck that goes and cleans it out, or do we don't have any facility, for example, for food trucks to go dump their grease, right?
No, this is about facilities as far as septic tanks. We have like 4 locations where they do have septic tanks, along with 7 grease trap areas where we go to.
Okay, but this is mobile. This is something,
Yeah,
a truck
they
that
go
goes
and
and
service
does.
the different.
So the city has no dump stations, you might say, for RVs or even the food trucks or anything, right?
Not that night, to my knowledge.
But that's not what this is for, right?
No,
This is for city
Yeah.
City
facilities.
facilities like the event center.
Okay.
the
Motion
city
to
center,
approve?
Second.
Yeah, wherever there's a grease trap or septic tank. So we have a
That's
motion.
owned by the city.
That's owned by the city, correct. We have a motion to approve in a second. Any further discussion? Those in favor?
Aye.
Aye. Those opposed? Motion passes. Thank you.
Oh, that was an aye for me.
Next, we have board appointments. Action item number 9, consideration and action on resolution number 2019-107 to appoint members to the Downtown Tax Increment Reinvestment Zone Number 3, City of Brownsville Board.
Good evening, Mayor and Commissioners. Earlier this evening, you approved an ordinance creating the Downtown TERS Number 3. The next step in the process in the creation of the TERS is for the commission to appoint 6 board members that will leave 1 slot for the Cameron County when they decide to participate in the TERS with their increment as well.
Can there be a city commissioner on there, or no?
Yes.
Okay. Has everybody considered their appointments?
No.
No, we didn't know how many there was going to be. I think I asked last time.
I think there's 6
Yeah,
plus
6
1 from the
plus-
county.
oh, yeah.
Who actually has one or who's ready to make one? I am as well. So 3, 4? Okay, and then we can leave the other 2? Okay. Commissioner
I
Galansky?
have 2, actually. First, I would like to appoint Basilio Gomez Jr. or Bacho Gomez.
Okay.
And, second, I would like for Commissioner Neese to be on there since it's his district, and that way he can relay whatever's discussed.
Okay, let's take them up individually then. First one, Basilio Gomez, you said?
Yes.
Okay.
Second.
We have a motion and a second. Basilio Gomez. Any further discussion? Those in favor?
Aye.
Aye. Those opposed? Second nomination is for Commissioner Neese. Do I have a second on that?
I just have a question. Is that going to fill his spot on the Tiers Board? Because there's 7 positions.
Yeah, I would not try to appoint anybody.
Okay.
I'll
So
second.
we have a motion and a second to appoint Commissioner Neese. Those in favor?
Aye.
Those opposed? Motion passes. All right. Commissioner Cowan?
I'd like to appoint Gerardo Martinez.
We have a motion for Gerardo Martinez. Do I have a second? Motion and a second. Any discussion? Those in favor?
Aye.
Those opposed? Motion passes. I'd like to nominate Manuel Casanova.
Second?
We have a motion and a second. Any discussion? Those in favor?
Aye.
Those opposed?
I'd like to nominate Narciso Escareño.
I'm sorry, I just coughed while you were talking.
Narciso Escareño.
Okay.
Second?
We have a motion and a second for Narciso Escareño. Any discussion? Those in favor?
Aye.
Those opposed?
So how many does that make now?
That's 5.
You and I.
No, I thought we appointed some last time.
No, that was
Was
for
that
the
it?
charter review.
For the
Charter review.
charter.
Oh, okay.
I think, are we taking that up too?
Yes,
I'll
that'll
have
be
mine by
later.
January the 7th if you want to put it on the agenda again.
So, but isn't that going to be too many? Because you haven't made an appointment, nor have I,
Right.
and the county gets 1.
Oh,
You follow me?
Do y'all want to kind of talk about it, figure it out, however you want to do it?
I think that was shady.
Can there only be 7 members?
Well, the ordinance that you passed accounted for 7 members, 6 from the commission and 1 from
All right.
the county. Now, of course,
That's
it's
fine.
a commission's prerogative to amend your ordinance.
Yeah, the thought it was to do an odd number so
I
that in
understand.
case there's a vote, Commissioner, but of course you're able to change that if you'd like.
We can increase it to 9 since we have a commissioner sitting on it.
How quickly do we need to get that up and running? Pretty quick, right?
Yeah, and we
Okay.
also wanted to be consistent with the other boards and commissions.
Okay.
The commission established a uniformity of 7.
Okay.
So we're trying to also stay within that.
Okay.
That
Well, let's look at that. But for now, we've got enough to get it going and operating.
For
And then we'll
quorum.
wait for the next meeting to appoint the last member possibly.
Correct.
Okay,
And
very
we'll be
good.
going
Maybe
to
you
the
and I
county
can
and
discuss
presenting.
somebody that we mutually agree with.
Cool. All right. Thank you.
Next, we have item number 10, consideration action on resolution number 2019-108 to remove and appoint a member to the Planning and Zoning Commission.
I'll say, I brought this one up because it had come to my understanding that, or it had come to my attention that there was someone who wasn't attending quite regularly. I just want to say that I'm equal opportunity. I have no biases against people because of their race, gender, whatever it is. My whole thing is that for these groups like GBIC, BCIC, Planning and Zoning, people come to these meetings because they're requesting either a permit or incentives. They've spent money to try to get these plans going or projects that they're trying to do. So it's imperative that we meet quorum for all of these meetings because we can't be wasting people's time and money when they have sometimes their life savings, they've taken out loans for these things. So I'm going to be a stickler about people's attendance. The city policy strictly says that we want a minimum of 75% attendance rate, and so I'm going to be watching about that, especially when it affects the public, when they're coming out for permits and incentives and things. So I realize that the person who I had been thinking about has only been there since August, and he's missed 2 out of 6, which would mean a 66% participation rate. But if y'all want to give him another chance, that's fine. But I want to put him on notice that I expect attendance and participation, or at least I do.
Who is it that you're talking about?
Aaron Rendon.
Okay.
Okay.
The Planning and Zoning Commission, the current Planning and Zoning Commission has also expressed a concern with the frequency of their meetings and their level of customer
Correct.
service to our development community. And so in 2020, the plan is for us to move from 1 meeting a month to two subdivision plat approval meetings and 1 zoning commission meeting per month.
That would be great.
Yes.
Mr. Vasquez, is it, do you know whether the policy that talks about 75%, is that a calendar year or how quickly? I know that typically it's, if you miss 2 or 3, likely 3 meetings in a row. Right, but then what about the 75% requirement? Do we know if that's a calendar year?
No, I think it'd be,
Because if somebody misses their first meeting, then they're at zero, right? So there has to be a reasonable basis to get to that 75.
then if he misses one, misses another one, makes the next one, then I think, you go from that forward. So if you miss three after from there.
Shouldn't it be within a year from their
Well,
appointment?
That's what I would think, but I'm just not sure what the policy says. So I'd like to get some sort of answer for that one. If we don't know the answer now, then by the next meeting.
We should have
So,
clarification.
Do you want to table that item?
Or do you just want to put it
She's
on,
back.
give notice or whatever, as you said?
Commission, it indicates both. There's both a 75% attendance requirement over the course of a year.
Okay.
As well as 3 consecutive meetings.
Got it.
So cause for removal is either or.
Okay.
Okay.
Wait, I think he didn't know if it
Yeah,
was a
but-
whole year or from the time they were appointed, right? So it's a year from the time they were appointed, probably, I would imagine.
So he's still within he's still good, right?
Well, sounds like it.
Yeah, no, then I don't even think we should take action on this item.
No, I
because-
think, Commissioner, are you
Or
going to
just
table
put
that?
you- And this is not, I'm not trying to make an example of one particular person. This just goes out to everyone. I think at least us, we got elected because we wanted to improve customer service. And so when you're not making quorum for some of these meetings because people have other commitments, and you know that you can't fulfill all these meetings, then maybe it's better to step down because there are plenty of people who are willing and capable of serving. And we can't be doing this to our citizens by not having quorum, and then they're wasting time and money especially, which is a big hardship for them.
So the Planning and Zoning Commission, have they had any meetings that have had to be postponed because of lack of quorum?
I think they did early on. And that's one of the reasons, once we got people appointed, that became less of an issue. I think they may have had a quorum issue once.
In the last couple of years, it happened quite frequently.
Right,
Yeah.
right. Okay.
So, okay, yeah, just let people know, especially when they're appointed to the boards, what day we expect them to be here and present in their seats making decisions. I think that's fair too, because.
Perhaps administration could send an official memo to the boards letting them know that we're serious about the attendance.
I think it's only fair because a lot of people apply and they have other obligations and it just becomes chaos and it's on us.
So what should we do with that item?
I'll move to table.
I'll second.
A motion and a second to
If you
table?
table, it doesn't have to come back.
It doesn't have to. We don't put it on the agenda.
Yeah.
Okay.
Until I see
Unless you
something.
bring it back, yeah.
Okay, we have a motion and a second to table. Any discussion? Those in favor?
Aye.
Those opposed?
I'll vote nay.
Okay. Item's tabled. Thank you.
Item number 11, consideration and action on resolution number 2019-106 to appoint members to the Charter Review Committee.
I would like to make a motion to appoint Daisy Zamora.
I'll second.
We have a motion and a second to appoint Daisy Zamora. Any discussion? Those in favor?
Aye.
Those opposed?
For my appointment, I'd like to appoint Michael Gonzalez.
Second.
Attorney.
We have a motion and a second for Michael Gonzalez. Any discussion? Those in favor?
Aye.
Those opposed?
For mine, I'd like to appoint Raul Gonzalez.
Second.
Motion and a second for Raul Gonzalez. Any discussion? Those in favor?
Aye.
Those opposed? Motion passes. Thank you.
Item number 12, consideration and action on resolution number 2019-109 to remove and appoint a member to the Greater Brownsville Incentives Corporation.
I'm going to move to table this one because I had asked for the attendance record for Mr. Lozoya right before Thanksgiving, and he submitted it. And so today I see that they submitted something else, and it's different from what he had said before. So I would like him or the Chairman Guerra to appear and explain the discrepancies. And I know that y'all are on the board. If you could please convey that message, because it's not what I don't know what's changed in the past 2 weeks, that his attendance report is different.
So your motion is to move to table and bring it back at the next meeting?
Correct, with him or the chairman
I'll
to
second that.
be here to represent.
Okay.
Can I just ask whose attendance we're questioning?
Pedro Cardenas.
Okay, we have a motion and a second to table the item. Any further discussion?
It's to table and bring back at the next.
Table and bring back. Okay. Motion to table and bring back at the next meeting. We have a first and a second. Any further discussion? Those in favor?
Aye.
Those opposed? Okay. Thank you.
Next, we have executive session items. We have executive session A pursuant to Section 551 and Section 551087 of the Texas Government Code to consult with its attorney to receive legal advice regarding a matter in which the duty of the attorney to the governmental body under the Texas Disciplinary Rules of Professional Conduct of the State Bar of Texas clearly conflicts with its Chapter 551 of the Texas Government Code, and to discuss or deliberate the offer of a financial or other incentive to a business prospect, Bumblebee. Executive session B, deliberation of personnel matters pursuant to Section 551.0741 of the Texas Government Code related to the evaluation of a public officer or employee, to wit, City Attorney Rene De Cos.
Motion to move to executive session?
Second?
Are we going to take up
can I-
B as well? Because
Yes.
I would say that we're not going to take up item B because he's not present, but don't we do that during the action items?
I believe so. So,
we can't move to table it now?
No, it has to be during the action items, right?
Yes.
Counsel?
I'm sorry, what do you want?
The question is, can we move to table B at this time since it was called for consideration in executive session?
Well, I would ask you have the executive session, then after that, take no action and table it at that point.
Okay.
But I think you can discuss in executive session.
I'll move that do we already have a motion?
yes, we had a motion and a second.
Call the question.
Those in favor?
Aye.
Aye.
All right. Recess to executive session.
Possible action on any items as discussed in executive session. Action Executive Item A, pursuant to Section 551.071 and Section 551.087 of the Texas Government Code, to consult with its attorney to receive legal advice regarding a matter in which the duty of the attorney to the governmental body under Texas Disciplinary Rules of Professional Conduct of the State Bar of Texas clearly conflicts with this chapter 551 of the Texas Government Code, and to discuss or deliberate the offer of a financial or other incentive to a business prospect Bumblebee.
Do you want to make the motion, Dr.
So
Gao?
the motion, I make a motion to, for the city manager's office to proceed as advised by consultants.
I'll second that.
We have a motion and a second. Any further discussion? Is that good enough for you guys? That'll work? Okay. Those in favor?
Aye.
Aye. Those opposed? Motion passes.
Next,
to
we have
adjourn.
action executive B, deliberation of personnel matters pursuant to Section 551.0741 of the Texas Government Code related to the evaluation of a public officer or employee, to wit, City Attorney Rene de Cos.
I'll motion to table.
Second.
We have a motion to table and a second. Any further discussion? Those in favor?
Aye.
Those opposed? Motion passes. We have a motion to adjourn.
Move to adjourn.
Second.
We have a motion and a second. Those in favor?
Aye.
Aye. Those opposed? Stand adjourned.